This video reviews 7 factors that may help explain why some people feel pain more intensely. Life is emotional, and there is no way of denying that. No matter our upbringing or personality, we all feel emotions, some stronger than others. As Earl Riney once said, our emotions are the driving powers of our lives. Although we all experience emotions, some people feel more profoundly than others. Their sadness feels like a monster that squats on their stomach and chest. Their joy is a bunch of balloons that float them to the sky. They cry easily and get stressed easily. Research has indicated that several different factors often result in a person experiencing more intense emotions. Without any additional weight, let's explore these factors. Number 1. Genetics. Genetics can play a role in how people experience pain. For example, some people may have a genetic predisposition to experience pain more intensely than others. This can be due to variations in the genes that control the production and function of proteins involved in pain perception, such as opioid receptors and enzymes that break down pain-relieving chemicals in the body. Estimates suggest that up to 60% of the variability in pain is the result of genetic factors. Stated simply, this means that pain sensitivity runs in families through normal genetic inheritance, much like height, hair color, or skin tone. Number 2. Previous experiences with pain. Previous experiences with pain can impact how a person experiences pain in the future. This is known as pain sensitization. When a person experiences chronic or intense pain, their body's pain signals can become exaggerated, and they may become more sensitive to pain. This can lead to an increased sensitivity to pain in the future, even in response to stimuli that would normally not be painful. Psychological and emotional factors can also play a role in pain sensitivity. For example, if a person has experienced a traumatic event or has a history of depression or anxiety, they may be more sensitive to pain. Stress and negative emotions can also increase the perception of pain. Number 3. Emotional state. A person's emotional state can play a significant role in how a person experiences and responds to pain. Stress, anxiety, and negative emotions can increase pain perception, while positive emotions and relaxation can have the opposite effect. For example, if a person is anxious or stressed, they may be more sensitive to pain. This is because stress and anxiety can activate the body's stress response, which can lead to the release of stress hormones such as cortisol. These hormones can increase inflammation in the body, which can exacerbate pain. On the other hand, if a person is relaxed and in a positive emotional state, they may be less sensitive to pain. Relaxation techniques, such as deep breathing, meditation, and mindfulness, can help to reduce stress and improve emotional well-being, which can in turn reduce the perception of pain. Number 4. Age. Age can affect how a person experiences and responds to pain. As people get older, they may be more prone to experiencing chronic pain due to age-related changes in the body and an increased likelihood of developing certain conditions that can cause pain, such as osteoarthritis or degenerative disc disease. In addition, older adults may have a lower pain threshold, meaning they may feel pain at lower levels of intensity than younger people. This can be due to several factors, such as changes in the nervous system, decreased production of pain-relieving chemicals in the body, and changes in how the brain processes pain signals. Number 5. Health conditions. Overall health and specific health conditions can impact how a person experiences and responds to pain. For example, if a person has a chronic health condition, such as arthritis or cancer, they may be more prone to experiencing pain. In addition, certain medications, such as non-steroidal anti-inflammatory drugs, can cause side effects such as stomach pain or headaches, which can contribute to the perception of pain. In general, people in good health may be less sensitive to pain and have a higher pain tolerance than those in poor health. This is because good overall health can help to reduce inflammation and improve the function of the body's natural pain-relieving mechanisms. Number 6. Overall tolerance. Pain tolerance refers to the amount of pain a person can tolerate before they feel the need to reduce or eliminate it. People can have different pain tolerances, influencing how they perceive and respond to pain. Several factors can influence pain tolerance, including genetics, previous experiences with pain, overall health, and psychological and emotional state. For example, people with a high pain tolerance may be able to tolerate more pain before they feel the need to take action, while those with a low pain tolerance may feel the need to take action at lower levels of pain intensity. Number 7. Cultural and social factors. Cultural and social factors can affect how a person experiences and responds to pain. These factors can include beliefs and attitudes about pain, pain management practices, and social support. For example, some cultures may emphasize stoicism and the ability to endure pain, while others may place a greater emphasis on seeking medical help for pain. These cultural values can influence how a person perceives and responds to pain. In addition, social support can play a role in how a person experiences and copes with pain. People with a strong network of friends and family may be more likely to feel supported and less isolated, which can help them manage their pain more effectively. So how can you cope with managing intense emotional experiences? While you cannot change your biology or prevent yourself from experiencing painful emotions, you can change how you respond to your intense emotions. This will help you effectively manage them, which helps to alleviate emotional suffering. Here are some tips on how to manage intense emotions. Cope ahead. Identify the kinds of situations that tend to trigger your intense emotions. Then, anticipate these situations, and plan how you will cope with them in advance. This means proactively selecting the skills you will use to get yourself through a difficult situation. Check the facts. When you feel intense emotions, try to take a step back from the situation and identify any extreme or inaccurate thinking happening at that moment. Checking the facts will likely help you to form more accurate interpretations of the event. This will decrease the intensity of your emotions and help improve your mood. Act opposite to an emotions. Each emotion is associated with an action urge. This means that emotions urge us to act in certain ways. For example, when we feel sad, we have the urge or impulse to withdraw or isolate. When we feel angry, we may feel like attacking something or someone. Fear and anxiety are associated with the urge to run away and avoid. Guilt is associated with the urge to apologize or repair. Shame is associated with the urge to hide. Research shows that when we give in to our action urges, we reinforce painful emotions and often end up feeling worse. Acting opposite to an emotion's action urge can help. It's difficult to do, but it can help you change your negative emotions. This can mean getting active when you feel sad or being nice to those who frustrate you. It can mean approaching scary situations or confiding in those you trust when you feel ashamed. It is important to know that experiencing intense emotions is not necessarily bad. Being able to experience a range of emotions is a normal and healthy part of being human. However, if someone's emotions are causing them distress or disrupting their daily life, it may be helpful for them to seek support from a mental health professional. We hope this overview and the listed strategies help, and please comment below.